All right, good morning. Welcome to the Thurston County Board of County Commissioners budget work session. It is Thursday, October 7th, 2021, 10:05 a.m. My name is Ty Menser, Chair of the Board. To my left is the Vice Chair, Commissioner Gary Edwards. To his left is County Manager Amir Chavez, Assistant County Manager Robin Campbell to my right. Commissioner Carolina Mejia is zoomed in. We have the coroner this morning, just one presentation this morning. We'll have 3 more this afternoon. But this morning's session is 10 to 10:45 scheduled, and it relates to the coroner's office. So do we need to start with you, Robin, or go over to the coroner?
Actually, we'll just start off by saying that the next 2 days, today and tomorrow, we're focusing on the law and justice sector of county government. And I'm happy to welcome the coroner here to chat with you today, and I'm going to turn it right over to him.
Okay, good morning, commissioners, and Romero and Robin. Thank you for this time for me to present our budget moving forward for 2022 and 23. Also on the line with me is Christina Vilsack. She is one of 6 investigators here. She was the dominating force behind this PowerPoint, who pretty much put it together on her vacation over a two and a half week period by pulling all the information and putting this together. So she's going to assist me tremendously this morning going through these, and hopefully we can get through it on time. So with that, I will share what we're going to be doing. Let's see here. Share. And where are you at?
Hey, Gary, are you just trying to make me feel good that you're a little slow on the draw and that stuff?
No, we just learned it this morning. No.
I thought you were trying to make me feel good because I resemble that.
Let's see. That's not what I want you to see. So are you seeing that?
There you go. Yeah. Yep. Good.
Okay. All right. Okay. So so this is who we are in today's date. As you may or may not know, we operate 24/7, 365 days a year. Death does not take a holiday, nor does it discriminate. And this is, we're mandated by RCW to carry out our function as death investigators. And what you see here are the cases that we do investigate.
Okay.
Go ahead, Christina.
So as Gary was saying, we do investigate every death in the county through a tier system, but no person can be cremated or buried without approval from this office. So it's not just unnatural deaths, it's every death. The most basic investigation, screening, data entry, et cetera, can take about 2 to 4 hours. So the coroner's office is one of those agencies that doesn't fit under one umbrella. It's not under just the law and justice or just public health. It's kind of a hybrid of the two, which is why we're medical legal death investigators. But the implications of the data we collect are very, very important. And the accuracy of those statistics are very important. So in addition to determining cause and manner of death, we are the people who notify next of kin. We identify the deceased, and we try to identify trends in real-time statistics. So the functions of our office bleed into law and justice in that, we testify in court, we exonerate the innocent and pursue the guilty. We're part of that process. And there's another area, but it's kind of complicated. If we have time, we can get into it later. And with public health, there's a little bit of overlap there as well. Because we're the front line of seeing why people die, what they're dying from, those stats are important to public health because they then take that information and it determines what research needs to be funded. Are we seeing a big uptick in suicides? drug overdoses, how can we get preventative procedures started now? And I say real time so you don't end up saying, oh, 2 years ago we had a drug problem. Wish we would have started preventative efforts then. We also identify unsafe commuter products, and we have those taken off the market. I'm thinking, certain baby cribs is a good example of that. We identify public safety hazards such as this. Thurston County is in the midst of a major opioid epidemic, and we have a lot of meth here. So we identify those as well. And then we try to get the information out to the public so we can immediately start preventative measures. So our office is the reason why seatbelts exist, why helmets exist. And so it's the implications are very big. That's what I want to leave you with on that. Slide.
Okay. So this one here is our budget. As you see, we have 7.5 employees currently. That's 6 full-time investigators, myself, and then a half-time admin assistant. And then for 2021, there was an amendment where we received $60,000 to hire an extra help person to operate the morgue and operations facility as far as autopsies. He's our technician. Moving forward into 2022 and 23, you'll see that I have a very large ask moving forward over the next 2 years, and we will get into that and how that affects the staff and the community at large.
Okay, so our key challenges going into 2022 and 2023 ultimately are a result from insufficient staffing, which is not your fault. You only know what you know. But it's created huge liabilities and risks, and it's also decreased agency efficacy because we're spread too thin. These are the three main areas that I've identified, the highest, most significant. They're there, and we'll go into more detail of all of them. Slide.
Yeah, real quick on this page here. For the last several years, we've been hearing from the board is that you're going to have to do more with less, and we've done that for several years. And right now, we're at the cutting point to where we can't do any more with less people. So this is why we have this very large ask.
All right, barriers to compliance and safety. So limited staffing has caused the 6 investigators to absorb most of the basic office functions, administrative responsibility, and with the loss of our morgue operations person in setting of COVID, he had to retire. We have had to absorb all of what he was doing, which was a lot. And obviously when you have that happening, you get spread too thin, overwhelmed, and you aren't able to focus primarily on your role as a death investigator. And it also makes it so we would love to prioritize certification and accreditation, but things keep popping up. So it's made it harder. And it's caused the issues that are listed in the middle, unable to meet the accreditation standards of 1326, which is up next. Liability, we have unsafe work hours, liability due to being sleep deprived, but we're also more unsafe work practice. We're inevitably doing out of scope job practices. Some of it's not, it doesn't present like an emergency risk, but we're not qualified to be ordering, storing, and disposing of toxic chemicals. We have no business developing advanced protocols for histology and toxicology. So we're trying to mitigate that risk by bringing in positions where you have specialized, qualified people in those roles.
Yeah, and then on this one also, it creates having these investigators perform other functions rather than death investigations. Like when we lost our autopsy tech, we didn't have anybody to to put in there as a backup. So I instructed my staff that you're going to have to rotate those shifts going in there. And if you're doing 2 or 3 exams a day, that's all day in the morgue. And that investigator lost all the work day trying to make phone calls to families, physicians, and working on their case reports. So right now we have a current backlog of 700 cases that still need to be closed out.
And on that, I just want to make it clear that this is a staffing and time issue. It's not an incompetence issue. Between all of us here, we have well over 120 years of experience. It's not that we're incompetent. It's just we need more people. All right, the increased liability and safety risks of HB 13 for us. We work in conjunction with law enforcement a lot on scenes. So if they're less, our risk goes up. And I say that because we send one investigator to each scene. We rely on them heavily to secure the scene safety and then also to maintain a secure perimeter that allows us to focus on investigating. Without them, without that perimeter, we're exposed to a lot of threats and we will be completely distracted and unable to do the job, or at least efficiently and effectively. We are solo, untracked, unarmed investigators, so we also rely on them for their direct communication with dispatch. We respond to a lot of areas that don't have cell service, and that is all that we have. So with them responding less, we need to add more. It also has the potential to increase our workload, because what HB 1310 has done is it reduced them responding to community service calls, which are overdoses, suicide threats, which if you're not responding to suicide threats, you're going to have an increase in suicides. Welfare checks that gives the potential for people to not be found as soon as possible, and they go into a state of decomposition. Diabetic emergencies. Diabetes is a huge problem right now. I think it's one of our #1 causes of death. And so if you're not able to get them to a hospital and they're going to be dying at home, it's going to increase our workload. So we do have some ways that we're trying to mitigate these risks, and they're in our proposal request, but we'd really like to send 2 investigators to each scene.
Yeah, so what Christina, when she said tracked, when my investigators receive a call from dispatch, whether it's during the day or in the middle of the night, basically what they're receiving is a phone call from dispatch for them to call the scene and get information. And from that point on, dispatch has no idea where my investigators are at. They're never tracked when they arrived on scene, and they're never tracked when they depart the scene. They could be at St. Peter's Hospital admitting for x-rays or doing a notification somewhere out in the boonies in the middle of the night or during the day. Nobody knows where they're at. So as we move forward through this slide, you'll see we have some requests that would better track the investigators 24/7.
So House Bill 1326 compliance issues. At this, and I know that you guys have a copy of that, but what it basically says is that our facility and our facility needs to be accredited by Jan 21, and all of our investigators need to be certified by then as well. There are financial penalties if we don't meet those standards. So it took effect this past July, and we currently are only able to meet 47% of the accreditation standards. One of them is it requires a chief deputy position, which is something that we ask for later. A lot of the other ways we're not compliant have to do with protocols. They are either outdated, not written, or don't exist and need to. And then all of our investigators need to be accredited. That is something that we are working on. We were funded through a cover del to do that, to help mitigate costs to county. And we should all be certified by next year, by the beginning of next year. We also want to restructure our office organization to, effectively manage the increased demands of Thurston County. and staffing that's why we're asking for so many positions. Are there any questions about 1326? Okay.
Yeah, I will add that on the penalty phase for not being accredited or certified is that if your office is not accredited, the autopsy reimbursement will be, they'll cut 25% of that.
And other agencies will not be able to conduct autopsies at our facility, which takes away the revenue of facility fees.
Well, they can do the autopsies here. They'll just lose 25% as well
So what's
because they're not being performed in an accredited.
All right, start,
Yeah.
Commissioner McGee. Yeah, we've got a bunch of questions on this. Go ahead.
So
Sure.
what's the overall impact? You're talking about 25% of the money that we're receiving. How much is that?
Well, if we look at, currently for this year, we're on track to spend close to $400,000 on autopsies. So 40% of $400,000.
So you said 25%.
Yeah.
So how much,
Hey, Gary,
what's that?
I thought you said 25%, not 40%.
No. So right now we get 40%. So at $400,000, Thurston County is going to get back $160,000.
And at 25%?
Yeah. So, and if it's at 25% times,
I think there'd be a reduction of
1,000.
25% of the 145,000.
you get 100,000 back out of the 400.
I think that's what it is, okay.
Yes, thank you.
Go ahead, Commissioner
Uh,
Howard.
Currently, the coroner's office is unable to meet 47% of facility accreditation standards in the following areas. What does that equate to? Is there also a reduction in money that is pass-through money or something that comes along with that, or is that just the fact that you're pointing out?
That's a fact that currently we cannot meet 47% of the accreditation standards as the building sits right now with staffing, equipment.
And what does it take? I mean, do you have to miss 50% and then you don't get the funding, or how does that work?
Oh, I don't know where the curve is at there, Commissioner. I know there's some, I know you have to score at least maybe high 70s or 80s. That I don't know.
I believe it's 85%.
How many?
My understanding is that it's at least 85%.
Okay.
My understanding with all of their standards.
So are you currently not getting are you getting a reduction in funding now? And if we
No.
get something you'd ignore?
No, we still get the 40%, but come 2025, if we don't meet the accreditation standards, then they will penalize
Okay.
by removing 25% of that.
Okay, I see it. I see
Okay,
it.
so the deadline for compliance is July 1st, 2025, not next year.
Correct.
Yeah. Not
Robin
this.
had something. Go ahead.
So and is it that you need to meet a percentage of the standards or that you need to be accredited according to state law?
We need to be accredited.
Credited.
Thank you. So, and to get accredited, that's where it's X% of the standards.
Yes.
To
and I
get the
believe
accreditation. So
Yes.
to get the money, they have to be accredited. That's a yes or no. That's not a what % of standards did you meet,
Mhm.
right?
Yeah, regardless if we're accredited or not, you'll still get the autopsy reimbursement, but minus, you'll get 25% reduction.
And I think we've got $80,000 in the budget for revenue for that, but you usually get a little more.
Correct. And just the way it's looking right now, that's going to increase if the autopsy numbers keep increasing. So
Right.
whatever we spend on autopsies, Thurston County is going to get currently 40% of that back.
And you're saying that a piece of the accreditation criteria is what your staffing level is?
Yeah.
Yes,
But it's also outdated, non-existent written protocols, policies, procedures, and training.
correct. Like equipment would be an x-ray machine. You have to have an x-ray machine.
Which, thank you, that's one of, so first off, in the appendix, there's a more complete list in other areas. One of them is being able to conduct autopsies on most, if not all. And that is something that you graciously provided funding for. So that one, as soon as it arrives in office, that we can check that one off. You also provided funding to improve our transport equipment. That's a requirement that we will then be able to meet with the funds that you provided. We are going to get certified through the Coverdell grant, so that's one we'll be able to check off. So basically, with the funding that thank you, that you've already allotted last year for specialized equipment, combined with additional staffing, we'll have no problem becoming an accredited.
And one of the bullets
which is
here
something
says,
we want to.
oh, thank you. No, I get that. Oh, that makes sense. Thank you. The chief deputy position, that's a mandatory requirement or how?
Yes, it is. We have to, for an office our size, we have to have a chief deputy. And a chief deputy for an office our size is different from a lead investigator. They're very different. A chief is essentially it's the difference between a supervisor and a manager. The manager oversees a lot. They do outreach with the public. They're the right-hand man of the coroner. And they would be the person updating and making sure that we're in compliance at all time. Whereas the lead would still be doing investigations and just making sure, hey, you didn't do that. So they're very different.
County
But
manager.
our office needs a chief.
Okay, thank you. County
So
manager.
since you opened up for questions, I have a question related to the House Bill 1310.
To the what?
House Bill 1310.
Yes.
And have you talked to the sheriff's office? Because we had a conversation with the sheriff's office related to the 1310. And this was somewhat of a question that we posed related to the response when they found a deceased person on a scene. And their response was, of course they're gonna be responding to that type of calls. So have you touched base with them just to make sure that we connect the dots on that one?
We have, and we do have some documents in our supporting documents that Gary put together. To be honest with you, there's different agencies, even ones within Thurston County, are interpreting the law differently with regard to response.
Yeah, it's just not Thurston County.
The sheriff's office is the more, I don't know how to word it, but they support us. They're the most supportive of law enforcement agencies. If we ever were uncomfortable and needed to call them, I don't think that they would ever not respond if we requested them. I think that it's so new, there's a lot of misinterpretation, and each department's perceiving it differently, where you have Olympia Police Department who is saying, hey, we'll get to a suicide. If it's a suicide, we make that determination, not them. Then they'll just clear. And it depends on which law enforcement agency you're working with.
So the city, based on what you just stated, the city of Olympia police department has already made that statement? They will
Yeah.
not be responding for a suicide?
Yeah, not necessarily from the chief, but from officers.
Okay, thank you.
Yeah,
I think
there's
that there will think it's new, and it will, different departments are going to interpret it differently and respond differently.
Understood.
Yeah, so this law was written without the stakeholders being called upon. Fire and EMS, law enforcement, and coroners and medical examiners throughout the state were never briefed on this. So when this came out, we were kind of like, what's all this about? And then so I put together a packet that you'll see that how 1310 affects this office, and there's documents there that was signed by the police chiefs and the sheriff about what calls they plan on responding to and calls that they will no longer be responding to. So that's where we're at with 1310.
Okay, I don't want you guys to run out of time, so let's plow forward.
Okay.
So increased county demands, I'm sure that you're all aware that our population has just been increasing steadily. The number of deaths has increased as well, but 2 times how our population has increased. And I have some ideas about why, but if we want to talk about that, we can later. Homeless population, significant rise there. And that really affects our workload and how we can go into more. But 99% of the homeless population will receive our top tier, most time consuming investigation. Public health emergencies. This opioid epidemic and drug related deaths, we're set to double since last year alone. And like I said earlier, this is not a temporary problem. It's not an overnight fix. It is going to be a problem for a long time. And yeah, the COVID-19 pandemic, even though those are natural deaths, we still end up investigating a lot of them. But how it's affected us more is we have to treat everybody as though they have it. And I mean, decedents, when we're making notifications, when we're in families' homes. So that's going to increase our supply demand, our PPE. And as we touched on earlier, when you have an increased demand for supplies, the cost of those supplies go up. And this is due to our increased exposure risks. We can't not don PPE ever. We have to be fully gowned and we have to treat everyone. Also, every person that comes through our office, we swab them for COVID, and then we transport those specimens to St. Pete's for testing. So that is a 2-hour round trip alone. So it has increased time spent and caused overtime hours worked.
On that topic, can you use the, the drugstore test that, it's more of an instant test, 10 minutes or whatever it is?
We do not use those ones on decedents. We'd like to get some just for staff. We are a small office. We've already had 2 people positive for COVID, and that could wipe our whole office out. So we're really and we can't wait 3 days for the health department results. So we've been really lucky in that we have an agreement with St. Peter Hospital so we can get those results faster.
How quick do they get back to you on those tests?
Well, don't tell anybody that I told you. They can get back to us within 24 hours, depending on how busy they are. Sometimes it's several hours, so it's a lot fast.
But even so, wouldn't those instant tests be, I don't know, at least they give you a sense of some security?
Yeah, they're less reliable, but they're really expensive. And there's certain hoops that are keeping us from being able to get them from a grant for the health department. So the good ones are at least $20 a piece.
We are the health department. Tell us your problem.
I just reached out to him yesterday about getting rapid tests delivered here just because of our risk of exposure. And so I'm still waiting to hear back from them about that.
Okay, more to come on that topic possibly. Good.
Yeah, and then also on the COVID swabs, every case that is brought in here has to be swabbed before an examination begins, and that's a requirement from our pathologist. So no work can be done on the remains until the swab is completed and tested.
We can absolutely pay for those with.
Yeah, we could
Yeah.
pay for those
That-
for
that-
out of CARES. I think we can fix
That's not
that.
even a stretch.
Yeah, without stretching, I think we can help you there.
Okay.
Oh, fantastic. We'll have to talk more because that would be great.
Yeah.
So,
Okay, ready?
yeah, next slide. So all of this has led to an inability. We're not able to meet the primary functions of our office, which is a very major disservice to the residents of Thurston County. And we touched on what our functions were and how important they are. But we're stretched too thin to participate in review boards that we should be, that are actually also accreditation standards and that we always have before. So we need to get back to being able to meet those primary functions because, again, we're trying to improve health outcomes for all, so it's important.
Yeah, I want to add real quick. So Christina said, and you all know, we are a very small office. It's myself, six investigators, and my admin assistant. We are pulled from every angle that you can think of, that there's a meeting here that someone needs to go to, or you've got to go here for a meeting. I don't have the staff to do that, and I can't do it by myself. So there are a lot of important meetings that aren't being met. We don't have the staff to do it. IT, liaison, I mean, the list goes on. It's overbearing. So that's why we have this big ask.
All right. So in order to start meeting all of the compliance requirements and improving our office efficiencies, right on the left is our current structure. It's been that structure for a long time. Our proposed structure is on the right. And with this structure that we'd like to have implemented over the next 2 years, it increases our head count from 7.5 to 13. But honestly, that's what we need. So that's what we're trying to do. And then with that, we will have no problem with safety, compliance outside of the normal stuff we would encounter on a normal day.
Where does your chief fit in that proposed structure?
Chief is right where all of our coroner deputy investigators report to the chief.
Okay, I see it there.
Okay.
So
Why wouldn't the chief be why wouldn't he be kind of right under the coroner? And because there's other things that probably need to be coordinated and stuff. I'm just curious.
yeah, so the chief is essentially the manager of investigations, but she also makes sure the entire office is running. So that's why she arrows off, or goes up and is meant to arrow off to all, and then up to the coroner. That way Gary doesn't have 8 investigators talking to him all the time. So,
Which happens a lot.
yeah. And then it streamlines things, and there's a lot more oversight and making sure that our office maintains accreditation. So the chief deputy doesn't do investigations.
Okay.
On to the requests. Here we go.
Are you good, Commissioner Edwards? Are you good there?
I'm good.
Okay.
All right. So as I'm sure you've heard from every department, ranking our requests was very difficult. There was one that wasn't, and this is priority 1, a new full-time position, lead forensic autopsy technician. The board was kind enough to fund a temporary, it ended up being morgue operations person, and that has spread the workload and taken a lot off of us. We also need one in order to have pathologists continue to work with our office, and this is the qualified person to do the out-of-scope dangerous practices that we have been. So they're a lead forensic autopsy technician is basically a surgical technician for the pathologist, and then also has all of the morgue operations as well. So this increases our safety and facility compliance, and it makes us a more effective county office that able to improve health outcomes for all. So, and again, there was no question about what priority that position would be. So 2, increase in supply budget and professional services. At this time, and it's been this way for a long time, our entire operational supply budget is just under $11,000 annually. So it was low to begin with. But as you can imagine, when you have an increase in death, increased exposure to hazards, autopsies and professional service, and cost of supplies, when all of those are increasing, you're going to need an increase to your supply budget. And we've already talked about why all of those things are increasing.
Hold on one sec, Commissioner Mejia.
Could this be covered by ARPA?
Some of it could, not all of it. And that would only be for a short time. Their needs are going to continue into the
This
future.
is an ongoing request.
I didn't hear that, Commissioner Mejia. What was that?
This could be covered by ARPA funds.
Oh, okay.
Yeah, and my response, Gary, was in part. We could
Okay.
cover this with ARPA, but that would only last for a couple of years, and this is an ongoing need.
Correct. Also, I will add on the increase in professional services is that toxicology is a big expense for this office. I know Washington State Patrol, they provide a free service, but let's be real, nothing's for free. Someone has to pay for this, and it's generally the families that have to wait 3 to 6 months to get the results back. And that's unacceptable. So on all pending autopsies that we have, I made the decision that we would outsource that to a private lab, and it's $140 per specimen, and we get those results back within 2 to 4 weeks versus 3 to 6 months. So that allows the investigators to close the cases earlier rather than months down the road. So that's a cost that pending deaths are always increasing as long as, especially with the overdoses that we're seeing. If it's a pending autopsy, then it's going to be outsourced to a third-party private lab instead of the State Patrol.
And that's part of this increase, Gary, these professional services?
Yes.
Okay, thank you.
Yep.
All right, so that can't be it.
Right. Response to 1310, like we were talking about earlier, we're going to need to send 2 investigators instead of 1 to ensure safety in order to do our job. So that's why we're requesting 2 additional full-time deputy coroners, and that will make it so we're able to do that. So that's how one of the ways we're mitigating risk caused by decreased law enforcement presence.
Yeah, and I know, Romero, you had a question about this in regards to our sheriff. Even though Thurston County may change their mind and assist us on certain death cases or scenes, we still work with Yelm, Tenino, Olympia, Tumwater, and all the other jurisdictions to where they may not see eye to eye with the sheriff, what the sheriff's doing. So they just may hold their ground and say, hey, we're not coming, so you're on your own. So this is the reason for this request here.
And I will say real quick to that before 1310, we needed an additional deputy. And part of that is because when there are consequences to if we are unable to be here. If I'm leaving, somebody for whatever reason, because I'm sick, somebody has to cover my shift and it will swap. So when I get back, I am stacked with shifts, and when they cover, they're stacked with shifts. So you end up putting yourself in a position to work really long hours, go into overtime. So you don't get that refreshing return. So it was needed prior as well, but definitely that was exacerbated by 1310.
Okay, guys, the board has a hard stop with another event at 11. Commissioner
Okay.
Edwards has a question, and then we'll need to I don't want you to run out of time to explain all your pieces, so just be mindful of that time. Go ahead,
Okay.
Commissioner.
On several of your requests, you've got 22 and then 23 as a dollar
Yes.
amount.
Mhm.
Usually the 23 is a little bit less, and I take it that's because maybe you've got some equipment or something like that in the first request. But in actuality, should you get funded with the 22 request, I mean, the next time around, it's not an additional 149 that goes along for, it's just because it's another year, and your budget is undoubtedly gonna, once we give you, say we give you a 2022 position, I mean, it's just part of your office from that time on,
That's right.
and it's a pass-through. So although it might go up,
Right,
incrementally
But-
with cost of living or something.
right. So we can talk about the mechanics of how a budget is built. They've got this here correctly.
Yeah, no,
Yeah,
I'm
yeah.
not questioning, I'm just saying, it doesn't sound quite as bad if you look at it
I
that way.
understand. I understand what you're saying.
Okay, good enough, that's it.
So on to number 4. This is a really big slide. It is the request for a full-time forensic pathologist. This is bringing in-house stuff that we've outsourced, and we've reached the point where this actually costs the county less money. And additionally, it provides more oversight. We're able to do more autopsies. In the setting of a national shortage, we won't have to worry about somebody being here to do autopsies. So, and then we also have the potential for revenue generation later. But again, this is one that pays for itself and has so many added benefits for our office. And there's in the appendix, there's from financial services, it explains how it would cost county less when we're at our levels now.
Yeah, so the county can continue to outsource the pathology work as autopsies occur and continue to pay, say, like we're on track now, $400,000 a year where you're outsourcing, or you have an in-house pathologist at $260,000 a year annually. So that's where we're at with this. We can spend money or we can save money.
Gary, could I add something?
Yeah, go ahead.
Great. So I just want to comment, when you guys see your numbers for $154,000 in 2022, it actually costs around $260,000 for this individual. But Gary, we calculated out the reduction that he doesn't need now for professional service. So that's why you're seeing it. A pathologist doesn't cost $150,000 fully loaded. We're closer to the high twos, almost 3.
Right. So you factored out the amount that you currently have that would pay toward this instead of professional services.
Correct.
We did leave a little bit of professional service just, in case they call in sick and we still need that. So we left just,
Okay, good.
okay, thank you.
That's good. They did.
Okay, thank you.
So next slide.
Oh, sorry. Trying to turn my phone off.
So 4B, this is if the pathologist is not funded, then it's a request for an increase in autopsy budget. These forecasts are actually quite low when you think about them in terms of what we're going over, but that's what this slide is.
Yeah, and that 100,000 was projected in late June, early July. But we didn't have the crystal ball to tell us, getting past to where we're at now, that we would be where we're at 400, basically $45,000 a month in autopsies.
And then real quick, if we are unable to get an autopsy done here, we're stuck bringing them all the way to King County, which is going to be overtime and all that. And they just raised their prices to $4,000 per autopsy. So that number would be low. You want to do next slide? And I'm not trying to stop me if you have questions. I'm looking at the clock.
Keep going.
So full-time chief deputy coroner to start 2023. Again, we were trying to spread headcount requests. We talked about how this is a required position for accreditation and how it would reduce workload and increase oversight and office efficacy. So that would in turn provide better health outcomes for all, and we would just be a better functioning office that is better able to serve the county. Next slide. Half-time office assistant to start 2023. Again, we're trying to spread it. This is, again, when I was looking at the ranking, it was really hard. But we do need more administrative assistance. That would take a lot of workload off us, and it would also help Gary have an assistant, because we've only had a part-time one for over 10 years. So that's why we're asking for a half-time assistant with hope that it will equal one.
For the record, I'm probably the only elected in Thurston County who still codes his own invoices and sends them to financial services. Number
7. So premium pay for the lead deputy coroner. until we get a chief, we just need a supervisor. And so this investigator is still doing investigations, just has a little bit more responsibility in making sure that everyone is following new accreditation standards. So we thought a little bump up in her pay was a reasonable request. It's not that much, but it will improve consistency, because when we're inconsistent, it confuses other agencies and it'll streamline a lot of things.
Okay.
Number 8. So we talked about needing to send 2 people, having an extra vehicle. We also, as I touched on, we transport specimens in our own personal vehicles to outside agencies, which is a huge liability. So we need to be driving a county vehicle. This would double as, again, a third response vehicle as well. But we are, again, using our own personal vehicles, which is, to be honest, it's just inappropriate. That said, we have tried to mitigate cost to county by requesting this transport vehicle through the law and justice funding, which are the next 3 slides, because it does increase deputy safety because it allows 2 people to respond to one scene.
Yeah, I will add, currently we have 2 response vehicles. And if one of those vehicles is out running errands to, do body views at funeral homes, or they're stuck at St. Pete's trying to submit labs, and we get a simultaneous call for another response, we don't have that vehicle because it's out of service at St. Pete's with another investigator. So that's why we're asking for that 3rd vehicle.
Okay, so the next 3 slides are a bit redundant, so I'm going to kind of tie them all in together. In an attempt to mitigate cost to county, we are trying to take advantage of the Law and Justice Fund one-time purchases. So we're requesting mobile computer terminals that will track our location through our vehicle. We're requesting 12 radios, so we always have direct communication with dispatch, and in the event of a mass disaster, with each other. And then that 3rd response vehicle. So the next 3 slides cover all of those requests, and fingers crossed that they'll be able to be funded through that. But those requests greatly address our safety concerns and ability to respond and be effective. So our key milestones, this is what we're hoping to do. Like I was saying, the board was kind enough to give us a temporary technician this year. We want to add 2 investigators and make that full-time autopsy technician our number 1 priority. Have that start in 2022. We'd really like the full-time pathologist as well. 2023, we want to hopefully have our become accredited with a full-time administrator and a chief deputy, and then definitely be completely compliant with 1326 by the beginning of 2025 at the latest. But I think that we can be ahead of the curve on that, especially as the largest coroner's office in the state and the capital county as well. We can do it. We definitely can do it with what you've given us and what we need. Things to consider, obviously, as you know, we're not able to control the number of deaths or autopsies and all of that. I know you know that. Increased staffing will decrease overtime and unsafe work practices, increased compliance. We do generate revenue, about 11% of our annual budget this year for the general fund. We do investigate every death in the county, not just unnatural ones, through our different tiers. We do try to utilize grants when available, when we have requests that qualify, and triage drug deaths and additional testing with rapid screens provided through a grant. We do try to reduce supply costs through multiple use when appropriate, and do price shopping when you realize the gloves from your vendor have increased 200%. Maybe it's time to check out another vendor. And with the funds that you were kind enough to give us and future funds, we are investing in equipment and positions that reduce outsourced costs, decrease liability of safety risks, and increase means to effectively serve the needs of the county. So we're investing in positions and equipment that improve our office. So we think about what we need and do a lot of research into what would be most effective. And so in conclusions, when we talked about our key challenges were safety, liability, and compliance, the increased demands of a fast-growing population, and the ability to function and serve the citizens. All of these things check that box, or those boxes. Like we said in the appendix, you've got some supporting documents. You have the different tiers. They're written in my language. I realized that wasn't the best way. How I calculated the 11%. It goes into a little more detail. You could slide about other areas where we're not compliant at this time. And then there's the pathologist cost comparison from financial services. Slide.
Okay,
So
we're out of
those-
time. Is there any final questions for Coroner?
The only thing I would ask, are you tracking your unfunded mandates at this point in time?
The unfunded mandates would be the 1326, the accreditation. That's all unfunded. So that's an out-of-pocket expense to be accredited. We did have a grant for testing, which that has to be spent, I think, this year because they rolled it over from last year because of COVID, because locations were closed down for testing. So some people are coming back on board to allow testing. But as far as having auditors from the International Association to come here and audit the building, that would be an out-of-pocket expense. That would be travel, lodging, their meals, and whatever the costs are for the audit.
Okay.
And that could be $3,000 or $4,000.
Thank you, Gary, and thank you to your team. We're going to conclude this session. We're going to pick up at 1:30 with the Sheriff's Office and Pretrial Services. Thank you.
Okay.
Adjourned.
Thank you.
Thank you.